Statement update, I would like to introduce the delegation I've come with. I'll start with Dr. Jonas. I'm sure is very well known to all of us, the WHO country representative. The CDC director, Dr. Lisa Nelson, and Mr. Tek Kajirita, who is the incident commander for COVID in this country. Viewers, the Ministry of Health is going to give you an update on the COVID-19 outbreak in Uganda. The first issue I want to highlight is the issue of our call center, and I want to give details about this. The Ministry of Health has received several concerns from the general public about the challenges with our call center. Following the declaration of COVID-19 outbreak in Uganda, our toll-free lines have been heavily congested, and most callers are not able to get quick assistance or sometimes even to go through. We acknowledge this concern and we are really sorry about it, but as I've already said up, it is mainly because of the heavy congestion that exceeded the capacity of our call center. To address this challenge, we are working with our partners and some private institutions like MTN, Airtel, Communication for Development Foundation, Uganda, which is an implementing agent, Mario Stops, Uganda, which is also an implementing agent, and NITA-U. So we have increased the capacity of our call center to handle more calls at the same time, and this will be effective this evening. Going forward from this evening, our call center is ready to take on more calls than hitherto we have been doing. The number of call center agents have been increased from 20 to 100, and these will continue working in a 24-hour shift every day. So we'll be having 100 people divided in 3 shifts working on our call center every day to receive your calls. But also the lines coming in and the capacity of our call center has been heavily increased, and will be receiving all your call centers. So we would like to reiterate that the public is encouraged to call the Ministry of Health numbers, call-free numbers 0800 100 066. That is one number. The second number is 0800 203 033. That's the second line. And the third is 0800 303 033 to enable you reach our surveillance teams so that they can assist you. So I want to emphasize that again. From this evening, our capacity to receive calls from our people has increased, and you'll be able to reach us on our expanded capacity. The second issue I want, or as a ministry we want to brief the country about, is what we had already talked about, our travelers from Dubai. Following our appeal to all individuals who traveled from Dubai in the past 2 weeks, we have so far line listed 574 individuals who have come into the country from Dubai in the last 2 weeks. The ministry is in possession of all the passenger details from their respective airlines for the last 2 weeks who came in this country from Dubai. Yesterday, we received 60. You recall, we invited them to come to the Ministry of Health so that we can screen them and assess them and assist them, because of the too many calls, or the too many numbers, or the previous numbers we received which had been coming from Dubai. So we have so far received 60 travelers from Dubai yesterday in Mulago, and we further direct that all persons who traveled from Dubai in the past 2 weeks should come to Mulago, the new Mulago, what we are now calling Mulago National Specialized Hospital, to be assessed and receive further assistance. So that is the issue to do with our travelers who came from Dubai in the last 2 weeks. We continue to encourage you, to advise you to come and receive assistance at Mulago, Ward 2A. The third issue I want to brief the country about is the new cases we have confirmed of COVID-19. As of today, 25th March 2020, there are 5 new cases, confirmed cases of COVID-19, which brings the total number of confirmed cases to 14. You recall that we received 1 case. In the last briefing, we told you of 8. That is 9. Now this is 5, bringing a total to 14. I'll briefly give you the details about these 5 cases. The first is a 63-year-old Ugandan male, a resident of Najanankumbi, who traveled from Germany and is currently under quarantine. He presented with high fever, cough, sore throat, and shortness of breath. That is during the time of quarantine. So our medical teams picked a sample from him, took it to Virus Research Institute, and he tested positive. The second case is a 57-old Ugandan male, a resident and businessman in salt trade in Adjumani. He presented with sore throat, difficulty in breathing, cough, and flu. He's admitted at Adjumani General Hospital and isolated there. A sample was taken from him for testing and brought to Entebbe, and it turned positive. Further details show that this man has not traveled before and has not been anywhere out of this country. But we also know that he does his business at Elegu border point, that is at the border crossing point between Uganda and Southern Sudan. So he goes there, sells his salt, and comes back to his house. There's no history of travel abroad or even contact with anybody who had traveled abroad. The third case is actually an 8-month-old baby, a Ugandan resident in Iganga, whose father traveled from Kenya, Kisumu in Kenya, about a week earlier. So the baby presented with flu and difficulty in breathing and was brought to Iganga Hospital, where the baby was admitted. But seeing the signs and symptoms of the condition, the health workers took a sample, which they sent to Virus Research Institute, and the sample tested positive for this young 8-month-old baby. So those are the 3 cases. And now the 2 other cases were 2 Chinese who traveled from Guangzhou and Linyago. I think Linyago is another city in China, who have been currently under quarantine in the country. But you will recall these 6 Chinese, they are part of 6 Chinese who had tried to cross to DRC. I think somehow they escaped out of quarantine and tried to cross to DRC via Zombo district, but were brought back and put back in quarantine. And samples of these 6 were taken off and taken for test in the same place in Entebbe. The 4 tested negative, but 2 tested positive. So these 2 Chinese plus the other 3 Ugandans makes the total of 5 cases that we are referring to here. I also want to reiterate what the moderator has already said, that all the previously confirmed cases, the 9 cases, are in a stable condition and are doing well, and they are feeding, and they are fine, and they are all in Entebbe Hospital. What we used to call Entebbe, many people know it as Entebbe Grade B, but it is actually Entebbe Hospital. To date, a total of 2,661 travelers, including Ugandans, have been identified as potential risk and have either been on self-quarantine or institutional quarantine. Of these, 1,230 are under follow-up. 760 of these have finished their quarantine, while 764 of these are under institutional quarantine. I want to clarify that. Those under institutional quarantine now in different places are 764, while 466 are under self-quarantine. Those are the ones who started earlier before we introduced a mandatory institutional quarantine. So that means these are about to complete. A total of 1,431 high-risk travelers have completed their 14 days. Now, the people who have completed their 14 days are 1,400, and we have stopped the mandatory follow-up of these cases. And we have even issued them certificate of completion of mandatory quarantine. The Ministry of Health has developed a list. Furthermore, I also want to clarify on the issue of districts, especially districts which are far from Kampala, and how they will be contacting us or making their appeals known. So as a ministry, we have developed a list of district health officers and district surveillance focal persons, and got their contact telephone numbers. And we are going to circulate this to the general public so that the general public can respond or report their alerts to their respective district officials, so that somebody, let's say in Amulata, doesn't have to call Kampala. Somebody in Kisoro doesn't have to call Kampala. Somebody, so we are decentralizing this alert system so that you call your district officials, and then the district officials will assist you in the way possible. If the district officials find it that it requires central intervention, then the district officials will be the ones to alert us. We are trying to decentralize this one in order to make it more user-friendly. So I would like to appeal to the general public to cooperate with the measures that were put in place to prevent the spread, the further spread of this COVID-19. In the same vein, we continue to appeal to the general public to remain calm and practice the preventive measures that we have always been talking about. I'm sure these are very well known, including to the very old, the issue of washing your hands with soap and water, and detailed washing of hands, not quick washing, but spend at least 20 seconds washing your hands, or use an alcohol-based rub if available, to maintain a social distance of at least 2 meters from your next neighbor. And if you have flu-like symptoms, cough, or your nose is running, please cover your mouth with a mask, or calmly isolate yourself and call the toll-free numbers, which I want to repeat here, the 0800 100 066, the second number 0800 203 033, or 0800 303 033. Fellow viewers, the Ministry of Health would like to encourage the general public to always verify information from the ministry to avoid spreading false rumors which cause unnecessary anxiety and panic. As many of you know, there's a lot of information going around, especially through the social media. Please verify with us and avoid panic and anxiety. And we shall continue to give you updates regularly, either through our portal or Ministry of Health website. Thank you very much.
Thank you so much, Dr. Henry Mubesa, the Director General of Health Services, Ministry of Health. To you watching us, the Ministry of Health team is here to give an update on the COVID-19 situation in Uganda. And according to what they have just shared, there is a confirmation of 5 more cases, and this has taken our total number of the cases to 14. That means we have to practice more the precautions that the experts and authorities have stipulated to us to ensure that we remain safe and we don't allow more numbers to get into the trap. So the number is on your screen. You are expected to call and ask some questions, get more enlightened about where you feel the ministry should give you more information. The number is 0702 232 425. On behalf of the people watching us, Dr. Mwebesa, I would love to ask one question. You have asked people to go to their district headquarters. You have referred them to the district headquarters for some assistance and things like that. What kind of the services? What is the detail of the services that are at the district or the health centers in terms of COVID-19? Yes. As we wait for the calls.
Thank you very much. What we are advising is they call. We don't want people to swarm the district headquarters. What we want them to do is to call
Ministry of Health direct.
No, they'll call the Ministry of Health direct, but they'll also call the district lanes that we are going to circulate.
Okay.
So if you are in, let's say, Gongedwaako, you call the district health officer or the district focal person of Gongedwaako district. Then that person will assess the patient or client.
Okay.
After assessing the patient or client, then we'll make arrangements. If the person fits the criteria for taking a sample, then they'll make arrangements for the sample to be collected. And then through our hub system, we shall collect the sample and bring it to Kampala for testing.
Okay.
But they could also advise, like many of the calls we have been receiving, not everybody really qualifies to take a sample or to be quarantined or to be isolated.
Okay.
Somebody calls you and says, oh, I'm walking down the steps, but I'm seeing somebody coughing on the steps. Is it ways for me to go down those steps? So such a person would be advised, oh, that's okay.
Okay.
Or somebody says, I see my neighbor coughing in the compound. What do I do? Then somebody would give appropriate advice. Okay. In that case, we shall reduce the too many calls and avoid, because we are even told of some people who have traveled from Rukunjiri, from Arua, coming to Kampala to be tested. So we want to assist people to receive services in their districts. We are building capacity of the district offices to collect samples and to send them to the center for testing.
Okay. Yes. Okay, so we are ready to receive you callers. You will bring in your questions straight away to the ministry officials.